Erectile dysfunction is the inability to achieve or maintain an erection firm enough for penetrative intercourse. Erectile dysfunction is much more common than you might think, and depending on the data that you look at, as much as 40% of men as young as age 40 have some degree of erectile dysfunction. In my experience, the most common type of erectile dysfunction I see is the inability to maintain a sufficient erection for penetration. ED has many causes. Some of them are vascular causes, similar to coronary artery disease. Diabetes is exceptionally common, and in fact, diabetes is one of the primary reasons why a man might not have a sufficient result on oral medications for erectile dysfunction. Well, in my practice, I diagnose erectile dysfunction by asking my patient. I ask a number of questions. I ask him about the quality of his erections and whether or not he's satisfied with his erectile dysfunction. It's pretty easy for us. Well, I'll tell you in my experience, probably the best benefit of seeing a specialist in erectile dysfunction is having the opportunity to review all of the available options for treating erectile dysfunction. I can't tell you how many times I've had a man come into my office and relate to me the experience where he was told previously by a professional that if he failed an oral medication for the treatment of erectile dysfunction, there was nothing else to do. And that is so far from the truth. There are many options for you. Treatment options include oral medications, penile vacuum devices, penile injection therapy, intraurethral suppository medications, and penile prosthetic implants. I start off with a conversation with the patient, and I tell him everything that he can do. I go over all the pros and cons, and then I answer every question he can think of. And we come to the decision together. I'll tell you from a practical standpoint, once you stop having regular spontaneous erections, you do run the risk of penile atrophy, where you can lose length and girth over time. And this is reality. So be very, very conscious of what's going on with your health. And if you're not getting regular erections, I would really encourage you to speak with an ED specialist.